Welcome to Harrison Simplified session. Today's topic is unintentional weight loss, that is also known as involuntary weight loss. Clinically important weight loss is defined as loss of 10 pounds or 4.5 kg or 5% of one's body weight over a period of 6 to 12 months. There is no identifiable cause in up to one fourth of the cases. In cases of unintentional weight loss, even after extensive investigations, and this unintentional weight loss is encountered in up to 8% of all adult outpatients and 27% of all frail patients aged more than 65 years. And this unintentional weight loss is associated with increased mortality of 9% to as high as 38% within 1 to 2.5 years in the absence of clinical awareness and attention. So clinically important weight loss is loss of more than 10 pound or 4.5 kg or 5% of one's body weight over a period of 6 to 12 months. So this is very important. So what is the basic physiology of weight regulation with age? Among healthy aging people, total body weight peaks in 6 decade, and after 6 decade it remains stable until 9 decade, and after which gradually falls. So this is about total body weight. So total body weight peak around 6 decade, remains stable until 9 decade, and after which it gradually falls. And what about this lean body mass? This lean body mass means fat free mass. This lean body mass begins to decline up from third decade at the rate of 0.3 kg per year. So fat free mass begins to decline at the rate of 0.3 kg per month in the third decade, and the rate of decline increases further beginning at age of 60 in men and age of 65 in women. So after this age, 60 in men and 65 in women, the rate of declining lean body mass increases. So what is the reason behind loss of weight with age? Number one is age dependent decline in hormones like growth hormone and insulin like growth factor type 1 or IGF-1 that occur with normal aging. There is also loss of sex steroids at menopause in women and more gradually in men also contributes to these changes in body composition. And in healthy elderly, an increase in fat tissue balances this loss in lean body mass until very old age, when there is loss of both fat and skeletal muscles tissue occurs. These age dependent changes also occur at cellular level. So this age dependent cellular changes is also responsible for weight loss with age due to telomere shortening and also fat free portion cell decline or body cell mass decline. So there is cellular level changes with telomere shortening and body cell mass. The fat free portion of cells decline steadily with age. And there is also reduced mean energy intake with increased age. As an example, between age of 20 to 80, there is decrease in 1200 kilocalorie in men, and there is decreased calorie intake of 800 kilocalorie per day in women. So compare a 80 and 20 years old male or female, there is decreased energy intake in 80 years male up to 1200 kilocalorie per day, and in female up to 800 with aging. So this is the comparison of energy intake between 20 and 80 years old male and female. And there is also decreased hunger as a reflection of reduced physical activity, and as a result there is decreased demand for calories and food. And there is also declining chemosensory function like smell and taste with age, that results in also there is reduced efficiency of chewing because of loss of teeth, and several important age associated changes also predisposes to weight loss, such as this declining chemosensory function, reduce efficiency of chewing, also slow gastric emptying. And there is also alternation is neuroendocrine axis, like changes in the level of leptin, cholecystokinin, and neuropeptide Y, that results in early satiety and decreased appetite. So this is also known as anorexia of aging. So with aging there is alternation of neuroendocrine axis that results in early satiety and decreased appetite, known as anorexia of aging. And there is also some social issues like social isolation, poverty, and immobility. These factors also contribute to undernutrition in elderly. So, what are the causes of unintentional weight loss? Most causes of unintentional weight loss belong to one of these four categories. This is either malignant neoplasm, or chronic inflammations or infectious cause, or metabolic disorder like diabetes, hyperthyroidism as an example, and also some issues like psychiatric disorder. Not infrequently, more than one of these causes can be responsible for unintentional weight loss. So, the most common malignant causes of unintentional weight loss are like colon carcinoma, hepatobiliary carcinoma, hematologic cancer like leukemia, lymphoma, lung cancer, breast cancer, genitourinary cancer, ovarian cancer, and prostate cancer in male. And half of the all patients with cancer lose some body weight, and of one third of this patient lose more than 5% of body weight, original body weight. And up to 20% of all cancer deaths are caused directly by cachexia due to unintentional weight loss. So the mortality is also related to this unintentional weight loss or cachexia. Now, coming to other causes like gastrointestinal causes include difficulty in swallowing with age due to loss of teeth, malabsorption syndrome like Crohn's disease, ulcerative colitis, chronic pancreatitis, even peptic ulcer disease, gastric ulcer, duodenal ulcer, inflammatory bowel disease, Crohn's disease, ulcerative colitis, as pancreatitis, any obstruction, constipation, pernicious anemia, atrophic gastritis, celiac disease, all may be causes of unintentional weight loss because of gastrointestinal pathology. Now coming to another sets of cause, this is endocrine cause after gastrointestinal cause. This is hyperthyroidism, diabetes mellitus, pheochromocytoma, and adrenal insufficiency, Addison's disease. So what is the cause of weight loss in diabetes? As diabetes mellitus increase with age, and also there is glucosuria, so that is the reason behind weight loss in diabetes. And hyperthyroidism, one of the important features is weight loss. In elderly there may be less prominent sympathomimetic features and may present with only weight loss, that is sometimes known as apathetic hyperthyroidism. So in case of elderly individual, there may be only weight loss as a sign without any other signs like orbitopathy, dermopathy, etc. Now what are the cardiac causes of weight loss? That may be chronic ischemia or congestive heart failure results in hepatic congestion, gut wall edema, so anorexia, decreased food intake, even absorption problem. Even chronic ischemic heart disease can also cause even cardiac infection like subacute bacterial endocarditis can also cause unintentional weight loss. Respiratory disorder like emphysema, COPD can cause weight loss. Renal insufficiency like CKD, uremic symptom, patient may have uremic symptoms like nausea, anorexia, vomiting, so there is decreased food intake can cause weight loss. Rheumatologic disease like rheumatoid arthritis, systemic lupus erythematosus or SLE can cause weight loss. Even other disease like Sjogren's syndrome, dermatomyositis, MCTD or mixed connective tissue disorder, every rheumatologic investigation can cause weight loss. Infection, yes, one of the important is very important is HIV or AIDS. Tuberculosis, chronic parasitic infection, as an example strongyloides or hookworm infestation, etc. Subacute bacterial endocarditis can cause unintentional weight loss. Then medications like sedative, antibiotic, non-steroidal anti-inflammatory drug or NSAIDs, SSRI or serotonin reuptake inhibitor, metformin used in diabetic patient can cause weight loss. Then levodopa, angiotensin converting enzyme inhibitors or ACE inhibitors and other drug can cause weight loss. Medication usually cause weight loss due to either anorexia or nausea or vomiting or gastrointestinal distress like diarrhea. Even some drug causes dry mouth and change in taste. So drug causes weight loss by this mechanism: anorexia, nausea, vomiting, diarrhea, dry mouth and changes in taste. And this is particularly in the elderly patient because they usually take 5 or more medications. Then there can be issues like disorder of mouth and teeth like caries, then dysgeusia and others. Problem may be there like halitosis or due to poor oral hygiene, xerostomia in elderly patient, inability to chew, reduced masticatory force, non-occlusion, temporomandibular joint syndrome, edentullousness and pain due to caries and abscess can cause weight loss. Then age related factors like physiologic changes, as I have discussed in the physiology part of weight loss with age, visual impairment, decreased taste and smell, functional disabilities can cause unintentional weight loss. Neurologic cause like stroke, Parkinson, neuromuscular disorder, dementia can cause weight loss. And one of the important causes is depression and isolation, because inability to care for oneself including nutritional needs. And inflammatory cause weight loss because of cytokine mediated inflammatory cascade. And there is also social cause like isolation and poverty. Psychiatric and behavioral issue, as I have told, depression, anxiety, paranoia, alcoholism, eating disorders like anorexia nervosa or bulimia nervosa, increase activity or exercise. Even in 1/4 of the cases, even after extensive investigation, the cause may be idiopathic. So the causes are like cancers, gastrointestinal disorder, endocrine disorder, cardiac disorder, respiratory disorder, renal disorder, rheumatological disorder, infections, then your medications, disorder of mouth and teeth, age related factors, neurologic, social, psychiatric and behavioral, and idiopathic. So these are all the causes of involuntary or unintentional weight loss. So you have seen system involvement of all the system of our body can presence with unintentional weight loss as a manifestation of some occult disease. So, how to assess this unintentional weight loss? There may be 4 major manifestation of unintentional weight loss. One is anorexia, that is loss of appetite, or sarcopenia, that is loss of muscle mass, or it can be cachexia, that is a syndrome that combines these 4 factors. Cachexia is combinations of anorexia, loss of muscles and adipose tissue, both muscle and fat, weakness and weight loss. So this anorexia, loss of muscle and adipose tissue, weakness, weight loss together called as a syndrome cachexia. And even the unintentional weight loss patient can manifest as dehydration. So how to assess? So according to Harrison, this table is taken from Harrison, you have to assess if there is following indications like 5% weight loss in last 1 month, or 5% weight loss in last 1 month or 30 days, 10% weight loss in last 180 days or 6 months, If the BMI, body mass index, is less than 21, 25% food left uneaten after 7 days. If there is change in fit of clothing, change in appetite or smell or taste, if there is any GI complaint like abdominal pain, nausea, vomiting, diarrhea, constipation or dysphagia, in that case you have to assess for involuntary weight loss. So what are the important laboratory tests that you have to perform to investigate? The number one is CBC or complete blood count, and there is comprehensive electrolyte and metabolic panel like fasting blood sugar, your postprandial blood sugar, or maybe HbA1c, along with electrolytes like sodium, potassium, magnesium, even calcium, and metabolic panel even 25 hydroxy vitamin D3, your iron profile, serum iron, TIBC, then percentage of transferrin saturation, your ferritin level, or any vitamin deficiency if there is any indication, so ferritin. And also you have to test along with this CBC and electrolyte metabolic, you have to check liver and renal function test, so LFT and KFT, kidney function test, urea creatinine, and LFT bilirubin, SGOT, SGPT, ALT, etc., along with your total protein and serum albumin, serum globulin level. You have to check thyroid function test, free thyroid hormone and total thyroid hormone, along with TSH and erythrocyte sedimentation rate or ESR, then your CRP, ferritin, I have already described, HIV testing or other serology or immunocompromised state like HBS antigen, anti-HCV, etc. And for radiology, to rule out any malignancy or chronic infections like tuberculosis, you have to do chest X-ray, also abdominal ultrasound or USG of abdomen. And along with this, you have to also go for complete physical examination, even dental evaluation, medication history, cancer screening like CT scan or PET CT scan, even MRI, anything, or guided biopsy or FNAC. For elderly population, to assess the weight loss in elderly, specifically you have to go for these things like mini mental state examination, multi-nutritional assessment, nutrition screening initiative, simplified nutritional assessment questionnaire, even you have to check with geriatric depression scale. So you have to check with geriatric depression scale with whether the elderly individual is suffering from any depression. So geriatric depression scale, observation of eating, activities of daily life, and instrumental activities of daily living. So these are specially for geriatric population to assess depression or any neurologic, social, psychiatric or behavioral issues that is predominant in elderly. And what are the treatment? The most important and first priority in managing weight loss is to identify and treat the underlying cause, whether it is infection or inflammations or any systematic issue, endocrine, gastrointestinal, neurologic issues, and maybe malignancy. And if there is any causative drug, you have to withdraw the drug. And treatment of underlying metabolic, psychiatric, infection, other system disorder may be sufficient to restore weight and functional status gradually. And you have to ensure sufficient oral nutritional supplements, especially sometimes your high energy drinks reverse the weight loss, and advise the patient to consume supplement between the meals, because consume supplement between the meals rather than with a meal may help minimizing the appetite suppression and facilitate increased overall intake. There may be usage of orexinergic or anabolic or anti-cytokine product or agents, but that is under investigation whether you can use orexinergic, anabolic or anti-cytokine products. Even there is great results with such antidepressant like mirtazapine. So, in selected patient, the antidepressant mirtazapine results in a significant increase in body weight and body fat mass and leptin concentration. And patients with wasting condition who can comply with appropriate exercise program, so you should also advise appropriate exercise program to gain muscle protein mass, strength and endurance, and maybe more capable of performing day-to-day activities. So these are all about assessment, treatment and etiology workup. For next Harrison simplified video, don't forget to subscribe my channel Dr. Shankar Dey. Thank you for your concentration.